The OraLiva Onc Insight platform is the world's first AI-linked cytomics-on-a-chip technology that allows clinicians to identify early signs of cancer at the cellular level. Current screening tools are only sensitive enough to detect late-stage disease. However, there are 15 times more cases of oral epithelial dysplasia in the U.S. relative to oral cavity cancer. With their groundbreaking platform, OraLiva is poised to usher in a new standard of care that empowers frontline dentists and clinicians to identify and refer patients with early-stage disease. Providers that request an Onc Insight test are sent a sample collection kit, which includes a test requisition form, an illustrated user guide, a sealed sample collection brush, a sample transport tube containing 5 milliliters of cell preservation media, a specimen transport bag, and a pre-labeled shipping envelope. Before collecting a sample, complete the paper requisition form provided in your kit, or submit a digital version available online. If multiple lesions are to be analyzed, please use a separate sample collection kit for each lesion. When ready to collect the sample, remove the brush from its packaging, ensuring to only touch the blue handle. Place the cytology brush in direct contact with the lesion site. While applying firm pressure, rotate the brush 360 degrees approximately 12 to 15 times in the same direction. For lesions that are larger than the size of the brush, make sure to sample the entire area of the visible lesion during this process. For sensitive lesions, brush sampling can also be performed after the application of a topical anesthetic gel. If topical anesthesia is used, make sure to check the corresponding box in the test requisition form. Immediately after the sample is collected, remove the cap of the sample transport tube and insert the brush. Push the clear applicator on the neck of the brush downwards, popping the brush head off while avoiding direct contact. Ensure that the brush head is submerged in the transport solution and tightly replace the cap on the tube. Fill out the patient name and date of birth on the provided sample tube label and affix to the sample tube. Place the tube in the specimen transport bag. If you are using the paper version of the test requisition form, insert the completed form into the document sleeve on the specimen transport bag. When ready to ship, place the sealed specimen transport bag into the pre-labeled shipping envelope along with a copy of the patient's medical insurance. After the cell sample is received at OraLiva's CLIA certified lab, cells are added to a disposable cartridge and inserted into OraLiva's automated analyzer. Within the analyzer, fluid-filled blisters on the cartridge are compressed, isolating and labeling the cells with fluorescent dyes. The fluorescent signals are then recorded with the instrument's multispectral fluorescence imaging system. Using artificial intelligence, OraLiva's cloud-based analysis software translates these complex cytosignatures into an intuitive cytology score. With a strong clinical foundation from an international prospective study, OraLiva is excited to begin offering the Onc Insight test to providers in a regulated, CLIA-certified setting. To request an OraLiva Onc Insight lesion report for your patients, please fill out an inquiry form at oraliva.com.